In this next lecture, we will be taking a look at the web-based evidence resources to assist you in your clinical practice. In the EBP paradigm, it is the goal to use evidence that is valid, reliable, and impartial. There are research methodologies that are designed to help in achieving these goals. You will see pyramids represent these levels of evidence to help in selecting the material that you apply to practice. A key thing to remember is that the higher you go up on the pyramid, the higher the level of inference and the less materials that you will find. These methodologies are designed to reduce bias, accurately represent the measures in the experiment, and repeats the same results over and over again. In the pyramid we see here, the reviews of evidence are at the top. These methods synthesize the lower levels of evidence in the pyramid together. Examples include clinical practice guidelines, systematic reviews, and meta-analysis. Moving down the pyramid, experimental design is where you are directly implementing an intervention and comparison against each other, and the main example of this method is the randomized control trial. Non-experimental research generally tends to observe for or ask participants for feedback on outcomes over a period of time. Examples include qualitative studies and cohort studies. The final level at the bottom is expert opinion, where there is minimal methodology included in the design to reduce bias and increase reliability and validity. These types of methods can help you when you're searching for evidence. Some organizations only produce guidelines, so searching that resource will help you focus on the high levels of evidence. Some resources have filters that will allow you to narrow to specific research methodologies, like the randomized control trial. Now, let's take a look at where you can find some of these resources. The team of experts that created this course have created a resource guide for you to use, and all of the resources that we'll talk about in this continuing education course are linked from this page. The title is The Next Acute Care Resource Guide, and you can visit at https://go.uic.edu/AC next. Now let's talk about one of those high levels of evidence resources, guidelines. The Institute of Medicine Committee defines a clinical practice guideline as a systematically developed statement to assist practitioners and patients make decisions about appropriate health care for specific clinical circumstances. To produce a guideline, creators try to pull together the best available evidence to address the ranging health problems in the served population. When reviewing this form of evidence, make sure that there was an attempt to gather the evidence systematically versus trying to only base it on expert opinion. Next, we will be highlighting some great resources to help you find evidence-based practice clinical guidelines. The ECRI Guidelines Trust is a publicly available online repository of objective, evidence-based clinical practice guideline content. Its purpose is to provide physicians, nurses, and other clinical specialties and the members of the healthcare community with current clinical practice to advance safe and effective patient care. This centralized repository includes evidence-based guidelines developed by nationally and internationally recognized medical organizations and medical specialty societies. To access the guidelines, you will need to create a free account. Now let's take a look at this resource. The ECRI Guidelines Trust is a reliable source for uh, guidelines for practice. You'll see here that to access any of the materials, you need to have a personal account. You can create this account right on this front page, guidelines.ecri.org, and you can sign up here. I am going to log in with my account so you can see how or what materials are available in this resource. So sign in, and it takes me back to this front page. So from here, I'm going to use this main search box that's at the top and use some of the strategies we learned earlier in the presentation. So we want to group phrases together. So from that PICO question, we had our concept of heart failure as our problem. And then our intervention involved patient education. So I'm going to group those concepts together again and put an and in between them. So I get both of these two concepts from my PICO question represented in the search results. So with that, I'm going to click the microscope and scroll down a little bit so you can see what results are represented here. We have 24 results and have several guidelines represented. On the left-hand panel, you can see that there's filters available for you. You can choose publication year, the organization that created this resource, patient age, as well as clinical area and the intervention that's associated with what you're looking up. So these filters are very helpful in narrowing down search results to focus on your information need. I'm going to click on this first result, Heart Failure Evidence-Based Nutrition Practice Guidelines, to see what kind of information it provides. We have this left panel menu to navigate through the guideline. You have the objective of this guideline as well as patient population. It'll offer recommendation statements, any evidence rating scheme that it had when collecting the material to put into the guideline, the recommendation scheme, the benefits and risks. You can also go more in depth into the methodology, and like I was saying before with how they put guidelines together, you want to verify that they did a pretty inclusive job when it comes to synthesizing the evidence. Another feature of ERCI is this thing called the Trust Scorecard. This gives us an idea of what an organized group thinks of the recommendations prepared by the Academy of Nutrition and Dietetics. So we have a review of the composition of the guideline group. We have the systematic review of the evidence and how they did that, foundations of the recommendations, disclosure of funding sources, disclosure of the management and financial conflicts of interest, and internal review and updating of this guideline. So it gives you a lot of information to think about when it comes to the validity, the reliability, and sources of bias that might come into play when when looking at this guideline. So with that, let's head back and take a look at our next resource, the U.S. Preventative Services Task Force. The U.S. Preventative Services Task Force is an independent volunteer panel of national experts in disease prevention and evidence-based practice. The task force works to improve the health of all Americans by making evidence-based recommendations about clinical preventative services. Published recommendations are a synthesis of all levels of evidence and are assigned a grade to help providers decide implementation into practice for patients. Now let's take a quick look on how to find a guideline from the USPSTF. The U.S. Preventative Services Task Force is an independent volunteer panel of national experts in disease prevention and evidence-based medicine. The task force is appointed by the government to help plan out preventative services and make recommendations for the health of the nation. To find guidelines on this site, we need to look under recommendations. Recommendations are the other term for guidelines that this group uses. So I'm going to click on Published Recommendations, and from here we can search and filter to the appropriate recommendation. So I'm going to search out heart failure, and see if we have any material that might be available that relates to our patient education goals. And it seems like the majority of them are just skirting our topic. So let's take a step back and clear out this search and use our filters. Because there's only 129 results, published recommendations from the United States Preventative Services Task Force, filters are a very effective way of narrowing down to the information that you need instead of only using search keywords. So I'm going to use the category search to filter to cardiovascular disease. And I'm also going to keep scrolling down to click on counseling, as that is a very similar term to how patient education occurs. So looking at these results, scrolling down, I think I found one that might be relevant. So healthful diet and physical activity for cardiovascular disease prevention in adults with without known risk factors. So, and it looks at behavioral counseling. And you can see that there's a progress update needed here. And it gives you a recommendation summary, our clinical summary, which you can expand, and read about the population, risk assessments, interventions, balance of benefits and harms, as well as other relevant recommendations. You can see that they have the additional information all accessible here, as well as gives you some opportunity to read through these recommendations in the full list down at the bottom here. So with that, let's go back and take a look at some other suggestions on finding guidelines. Now that we've taken some look at some specific resources, we'd want to remind you that they're not the only way you can find clinical practice guidelines. Here are some suggestions, including searching some of the professional organizations and governmental agencies that focus in on your particular topic, and you can also search for practice guidelines in PubMed using the publication type filter to narrow your search results to guidelines. All right, let's shift a little bit to find some other resources for some of the lower levels of evidence available on the web. The following examples may have guidelines, but also those lower levels of evidence that will necessitate you engaging with the clinical appraisal process. Let's take a look at what's available. TRIP is a clinical search engine designed to allow users to quickly and easily find and use that high quality research evidence to support their practice and or care. As well as research evidence, it also allows clinicians to search across other content types, including images, videos, patient information leaflets, educational courses, and news. So it contains a wide variety of evidence. So let's take a look at how to work with this resource and see what evidence we can find on our PICO question. Has a great interface to work with and help you in finding information. I'm going to use the search box up here to enter in my search terms for my PICO question, and I'm actually going to use the PICO format to formulate my question and use it to return results to me. So in my population, which I could also term as my problem, I have my heart failure information need. I have the intervention of patient education, and then for my outcome that I want to measure, I want to look at readmission. So you'll see here that I need to spell remission right. I have two S's. Make sure whenever you're reviewing your search terms that you're entering in the correct spelling right. And here we have all three concepts represented in our search. So I'm going to click on the microscope, and you'll see that 170 results have returned, and it is sorted by quality. And so you can change that to date and then use the filters for evidence type to help you determine quality as well versus having them group it. So you'll see that of the ones listed here, we have some great systematic reviews and evidence-based synopses that are listed first. And from here, we'll actually link out to specific books, textbooks, resources on the web to help to support your decision making as well. So I'm going to click on our systematic reviews and see if there's any you can take a look at with this. So I'm going to click on this effect of nurse-led education on hospitalization, readmission, quality of life, and costs in adults with heart failure as a systematic review. And let's see where it takes us. It takes us to PubMed and the record there, as well as a link to the publisher to look at full text. If you have access to that, you can also request this full text from your library. So with that, going back into TRIP, this is a very simple database to use, and you can see how you can use the Pico search as well as use these filter types to really limit your search results. The Centers for Disease Control and Prevention is a huge source of health information for clinicians and patients. You have probably sought information from the CDC before. We still wanted to feature this resource as part of this course because it can be a little overwhelming due to its gigantic scope to the nation's healthcare. So, we will present some strategies for you to assist in finding some of the relevant information that you need. The main page of the Centers of Disease Control and Prevention. You'll see that there's a lot of information on this website, and so I wanted to give you a couple strategies to help manage that. First, I would like to show you the advanced search, which is right underneath the main search box. So I'm going to click on that link, and you'll see that you have this option of entering into certain areas of the search. So we have searching all of these words. You can search an exact phrase, any of the words, none of the words, etc. So from here, I'm going to use the exact phrase heart failure, and you'll see that the database will, or the search engine will group those terms together just like you did in the other ones with the quotes. And then I want to use education or counseling to try to grab that patient education component that we were looking for before. So with that, I'm going to click search, and you'll see the results where you'll have all of them grouped together, or you can divide them up into specific formats. So we have videos, no videos for this search, but we also have journals, and journals might be a really helpful source of evidence, and the CDC publishes a lot of material on preventative care. So from here, you can see that there's a link. I'm just going to click on this one. I know it's diabetes, but it will give you an information about a chronic care model and diabetes management. So it might be applicable to that area of health or heart failure as well. And you can read this just like you would another journal article. It's just like one of those, except it's published by the CDC. All right, so the next strategy that I would like to show to you is the browse strategy with the disease and conditions area. So with this pull down, we have several options already listed here, but if you clicked more, it would take you to an A to Z list if you needed to browse for additional items. So since heart failure is on the spectrum of heart disease, I'm going to click on that link, and you'll see that there's several links that the CDC is featuring, as well as some resources that are available. So from here, as a health professional, you might want to take a look at this resources for health professionals, where it also gives you guidelines. It collected them and have them available to you. There's also patient education handouts, on and various fact sheets. And then I'm going to click on Tools and Training. And one of the tools that might be helpful for you in patient education might be some of these public health programs, particularly one on sodium reduction. So here's information about that specific grant and the findings that they have from it. So from there, I hope that you are successful in finding and navigating through the CDC's websites, and wish you the best of luck to find information on this resource. The previous resources were just a sample of what's available to find evidence on the web. We wanted to remind you that we went over some resources earlier in this course, like PubMed and Medline Plus for patient health information, and they are great resources for information on the web as well. You might have encountered CINAHL working in your hospital responsibilities, as well as the Joanna Briggs Institute Connect resource for scoping and systematic reviews in nursing. And then we also wanted to point out the AHRQ's evidence-based reports that offer a lot of content on patient safety and quality improvement materials. So with that, it's really important to really think about the resource that's available and take the time to work with some of the search strategy that we presented earlier in this presentation to find the best available evidence for you. So with that, good luck, and please take a look at the Nursing Experts Translating the Evidence Acute and Ambulatory Care Guide for links to all of these resources. Thank you. These are the references that we use to create this presentation. We would like to acknowledge that this project has been funded in whole or in part with federal funds from the National Library of Medicine, National Institutes of Health, Department of Health and Human Services under the grant number 1UG4LMO 123 12346 with the University of Iowa.